Marion County has approximately 40% uninsured. People who are in between jobs or just don't have the means, they were utilizing the ER as their primary care doctor's office. That is not a good model. When you come to Heart of Florida Health Center, we try our best to be a one-stop shop. Built for children, it's built for adults. Heart of Florida was able to come in as a federal qualified health center. Take a look at the population and say, how can we better provide services? What can we do to provide health care to folks who may not have insurance? We have been able to continuously provide health care to anyone who needed it. Folks who have insurance, who do not have insurance, Medicaid, Medicare, and especially those who may be underinsured. If their copay is too high, their price of their insurance is too high, we've been able to provide that.
Our CEO and our Chief Medical Officer, we're very committed to whole person care. They have increased our behavioral health staff. So now all of our clinics have a social worker on site to provide a whole range of behavioral health services for substance use, for mental health disorders. Last year we also added a psychiatric nurse practitioner. She can help manage medications. With that integrated care, we're able to see better outcomes. In 2021, we saw about 4,400 patients.
We have 2 locations that have all those services. This location, as well as our Bellevue location further south in Marion County. We have a strategic plan, and we work together with my executive team, my directors, and we work with the board of directors to think about what are the demographics. And we all work together to complete that needs assessment statement. We can then work strategically to plan what do we want to add to our services. For example, we identified that we needed a larger facility to actually increase our access. Our access was good, but there were still a lot of people that could not be seen. So we purchased this 70,000 square foot building, and it's part of our strategic plan so that we can increase access.
Everyone that you meet in this organization is passionate about the mission and the values. They walk the walk, which is so inspiring. The quality of healthcare here is just amazing. Many times when we look at things and review policies and talk about staff members, I wasn't getting this level of care in the private sector. So it's comforting to know that that level of care is being offered to everyone, regardless of their status to pay.
One of the things that Heart of Florida invested in a few years ago were these telehealth machines linked to all of our clinics. If it happens to be a day where somebody comes in and they're in crisis and they need to talk to one of our clinical social workers, but that person's not on site, you can put that person right in front of that machine, direct dial wherever a social worker is available, and they can talk through the telehealth machine. It's secure, it's confidential, and the picture quality is so good that within a few minutes, honestly, you forget it's a machine. You really feel like you're there with the person.
As an organization, we set up the vaccine annex, deciding that we would take it out of our normal everyday operations and set up a place where we could actually do that and be open to the community. I mean, days where we were doing easily 800 vaccines in a day, and it just was because we are here to meet the need of the community.
We had humble beginnings, a small facility. We've evolved into this tremendous organization that has 8 locations. I'm a patient, my brother is a patient, and I've seen the organization step up and get just accolades during this awful pandemic, becoming a primary source of vaccinations and testing.
We had just started a family medicine residency program of about 30 doctors, and we had started an internal medicine residency program of 50 doctors. All of this was going on in the middle of COVID lockdown, and we put COVID in a backpack and kept going.
We work with a lot of the universities, students from Nova, from University of Florida. One of the other misconceptions about a residency program is I'm not seeing a real doctor. And all our physicians are licensed physicians. They are real, true doctors. They are just in their first few years of training. They're seeing patients under the supervision of an attending provider.
I see our gestational diabetes patients or maternity patients that might be having issues with diabetes during their pregnancy. That is a lifesaver for them because a lot of our patients have transportation issues or financial issues, and if they were being referred out to a nutritionist, they probably wouldn't go. So the fact that I'm in-house and I'm right here and they can come see me is a real bonus for our patients.
We have great partnerships throughout the community with both hospitals, Ocala Regional and Advent. We have the ability to work with all entities. United Way provides grants for our pediatric dental office, and so we're able to see more kids because of that.
Our partnership here with Heart of Florida hits on 3 key areas. The first is in education. We have a community partnership school where we're really serving not just the students in that school, but the whole neighborhood. A second area is in our Strong Families program, where we focus on making sure that families are financially stable. The third area where we focus is the room that we're in right now. It's the pediatric dental program here at Heart of Florida Health Center. We find that oftentimes pediatric dental care is really overlooked.
We're always looking for community partners. We just recently partnered with the Marion County Sheriff's Department, where we take care of all of the Marion County jail personnel, and so we're always developing partnerships. If you go to myhfhc.org, not only allows you to learn a little bit about our organization, our board of directors, our providers, you can go there, schedule yourself, and find out all the information about you, your labs, as well as request refills for your prescriptions. People come here to work because this is what they wanted to do, to see and take care of others. And they have done an amazing job because we have taken care of so many.